So 12 years back, my Nanu, he was diagnosed with prostate cancer. So after like 4 months, we thought the case wasn't improving very much. So we thought of like getting a second opinion, and that's when we decided to come to Apollo, and here we met Dr. Rajesh.
Mr. D.S. Pathania is an elderly gentleman who underwent radiotherapy for cancer of prostate a few years ago. And with the radiotherapy, the cancer of prostate is completely under control. But as a collateral damage, the radiotherapy also affected his bladder, and it has caused bleeding in the bladder. So we call it radiation cystitis. So as a result of radiotherapy, the bladder gets eroded and there are bleeding vessels which get exposed and they keep bleeding. So Mr. Pathania has been having blood in the urine, and not only that, the blood used to get clotted in the bladder.
He was in constant pain, and there was constant blood loss on his end as well. And he was like bedridden for about 2-3 months.
And he would have intense desire to pass urine, but because of the clots at the exit point of the bladder, he would not be able to pass urine. So he underwent multiple procedures through the urinary tract to evacuate the clots, put in catheter, and this happened almost 5-6 times in another hospital.
After meeting him, he recommended us to go through hyperbaric treatment. He suggested us to do like 20 sittings for that.
And here we found that this was a radiation cystitis. So we treated Mr. Pathania with what is called hyperbaric oxygen therapy.
He is now able to do all his activities, like all the exercises that he used to do
Initially, I
before.
was on the bedridden only most of the time.
And with that, he has improved tremendously and his bleeding has stopped. And I wish him all the recovery, because once the bleeding is gone, that means the bladder has started healing. Then there is nothing else that is left to be treated, because cancer of prostate anyway has responded very well to radiotherapy.
Dr. Rajesh Taneja and the staff and administration of Apollo Hospital were quite helpful and very considerate, considering his situation. So whenever we come down, every morning whenever we turn up to the treatment, they're very understanding. They make sure that especially the patient feels comfortable before going in and also after coming out from the treatment.
Radiation cystitis can occur to anybody who undergoes radiotherapy in the pelvic area. The treatment is hyperbaric oxygen, which is available at Indraprastha Apollo Hospital. And I'm glad to announce that we have been using this technology for more than 20 years at this place, and with very good results for radiation cystitis.